We have Philip Lee, who's the president of the Hong Kong Academy of Medicine. And also joining us this morning is David Lam, who is a lawmaker representing the medical and health services sector. Good morning to both of you.
Good morning.
Good morning.
Okay, Philip, let's go to you first. I know you have been involved in the Society of Transplantation. So hearing the news that the sign-up for the centralized organ donation register has hit an all-time high. So what are your thoughts on the number? Are you happy with it, or do you think there's still room?
Oh, first, I must say that I'm happy with the number because the number is getting higher, and as Professor C.M. Low mentioned, that we would be expecting higher number, more. But what I would say is, at the same time, this is encouraging. I think that we have to take note that this is the registration number of people who sign up for willing to donate. So it's about 6% of the total population, and we are still sort of have a large sort of number of people who have not signed up. And at the same time, we have to know that the signing up number doesn't mean that at the end the donation is in total parity. What I'm trying to say is that we are aiming at that those who become deceased, they would be donors, and then the relatives are willing to donate. So we need an even larger number, and also the overall culture of the society need to be moving towards the willingness to donate. I think that is another important area. So in short, I'm happy with the number. I'm hoping to see more, but then we need to have the culture of the society of the overall willingness to donate.
Thanks, Philip. So let me get it right in terms of the protocol. So Hong Kong has an opt-in system. So the people, and the individual has to give consent. That's number one. Number two, are you saying that the families, after the opted-in persons already pass away, the families also has a say on the matter? Is it correct?
What usually, I mean, the sign-in is not legally binding, but I have to say, most of the time, or even about all of the cases, if the individual has signed up already, the chance that the family say no is very low. So that is a good sign of it. And at the same time, in the whole population, it's only 6%, then we need a lot more. I mean, those, for example, if those who have not signed up, then in case they pass away, and then the family has the final say to say whether they would be willing to donate the relative's organ. So we always say that when you sign up for the registry, please tell your family members that you have the willingness to donate.
Okay, David, let's go to you. So I did a bit of background reading last night, and then I think, if I'm correct, that the sign-ups back in 2016 was actually half of today, which was 200,000. So it took us 8 or 9 years in total to double that figure. So, and Philip just said that Professor Lo Chung Mao, who's our health secretary, says he's ambitious and there's room for more. So how are we going to further grow that number moving forward?
Now, I agree with Professor Lee very much that the trend is encouraging, but then if you look at the actual numbers, it's quite low. So just around about 1 in 20 people around you have signed up for the donation. And as Professor Lee just said, it's just not legally binding. It's an expression of my wish. So we really have to do a lot more education to the public. Now, I have, on a few occasions, arranged some promoting organ donation promotion functions. Once we went into a university, so all the students are young guys, and then what alarmed me most was that back then, even youngsters who studied medical and health faculties are not particularly willing to sign up for the donation. Now, that's a serious matter. If you're studying for a nursing degree, for instance, then I would think that you ought to know more about the necessity and the benefits of organ donation to those who are really in need. And if they just think that, oh, this is far too distant, I'm still young and healthy, so donation is not my concern at the moment, I think that's a bit problematic. We really have to understand that things happen. And if we have not decided or planned ahead of time, then it might be too late. And as Professor Lee also mentioned, we need to tell our family members that we wish to donate our organs once we pass away. And that's particularly important in, well, we say it's a traditional Chinese society whereby organ donation or having parts of our body not together when we pass away seems to be not in line with what our tradition requires. But that's really ancient. At least for me, for my generation, who is not too young anyway, I don't have that notion. So I embrace organ donation. So I'm not quite sure how that traditional stands. It might just be a saying rather than a genuine belief in a whole body, intact whole body for cremation. So we do have to do in terms of promoting and educating. I would suggest that we regularly go to schools. Now, school is fine. We're not only talking about adults, but we are also talking about having this sense of donating the organs during younger time. And it's not only a drive for organ donation, but it's also education of how it is going to help people. So we have to start early and we have to go wide. Now, the Department of Health has 3 S. So you sign up yourself, you speak up, tell your family members and tell other people, and you spread out, go and spread the news.
David, totally agree with you about the traditional Chinese value, of the whole body has to be intact. You can't really take out any parts of it. This is quite entrenched in the older generation, but I do also agree that in the younger generation, this may not be so entrenched. But the promotion is the way to go. But can we go back to the protocol a bit first? So as I understand it, there is a central register for organs donation. How does it work? Tell us a little bit more.
Oh, this is now it is owned by the Department of Health. It was started many years ago by the Hong Kong Medical Association, and then now they transfer it to the Department of Health. And the easiest to sign up is to go online. Okay, so you just go online, click the sign up icon, and then you can do it there. Very easy. And it's a wish, an expression of one's wish to help other people once, unfortunately, one passes away.
I suppose we can change it after making our wishes.
Oh, yes, certainly. Mm-hmm. Yeah, certainly. We can always withdraw. And it is a wish. It is not a legally binding document. So at the end of the day, if things really happen and if I become a suitable donor, then there will be a transplant coordinator talking to my family members and telling them my wish and asking them to consider donating. And it is also not part of the Advanced Medical Directive. So I cannot say it's legally binding in any sense.
Okay, speaking on that change of mind, we now have a Facebook comment from one of our listeners. He's Henry, and let me read that out right now. And Henry believes that the current arrangement where the deceased had instructed to donate his or her organs after death, the family and still could negate the decision if they do not agree to donate the organs, especially if the deceased person had not notified them prior to the death. But Henry thinks that we should respect the decision of an individual and should not allow the family to overturn that decision. So, Philip, what do you think of that proposal?
I think that at the moment, because this is not a legally binding document and has not been sort of legalized to do this, so we have to respect that what is the current system. But as I said earlier, there's actually most of the time the family members would not negate what his deceased or her deceased relatives wish. But there are very occasional times. But in general, what we are trying to do in the hospital setting, because most of these donors are already in the hospital, and many were in the ICU, and these are difficult times for the family. So we would try to sort of at that atmosphere to help everyone to go through a difficult time, and in order to get the donated organs, but then not sort of having a big row with the family members. I think our transplant coordinator, or now we call them organ donor coordinators, they are doing a good job. And then most of the cases, as I said, if, as David said, get the registry data there and then show to the family members the relatives have signed up and persuade them, I think they are successful, I think, over 95 or even higher percentage of times. So I think if we are now doing it not in a legalized way, I think let's continue with this until we really want to sort of legalize this. As David mentioned, that because the one who sign up, they can always sort of withdraw such a wish at any time, and we are always trying to encourage people to do it and has a good will, and then we ask them to spread the wish. But I want to follow on a point that David mentioned. I think that the education of younger generations, especially David mentioned about healthcare professionals, even when they're student days. This, I mean, including medical, and I think David mentioned nursing students. I do think that we are sometimes a bit disappointed that even in this generation of healthcare professionals who are in the training are not actually signing up in a percentage that to us will be a satisfactory percentage. So that's why when I mentioned it in the ceremony, the Academy of Medicine, we formed the organ donation task force, and we hope that not only in the medical student days or nursing student days, even while they are training to become a specialist, we want to build in the concept of organ donation, all these about transplantation into curriculum of the training pathway, regardless which college they are in, which specialty they are in. And we try to see whether that will actually help a bit. Overall, in the hospital setting, we will be having different doctors in the different clinical wards. They will be seeing patients who are, because of various reasons, like stroke, like head injury, they will be entering the stage of brainstem death, and then they are potential donors. And nursing students as well, so I mean nurses, that they can recognize those who are potentially brainstem death patients and can refer to the transplant coordinators or organ donation coordinators. That is also one way to improve the awareness and also to increase the potential donation rate.
I mean, I'm not familiar with the procedure, but I think many people will have the gut reaction that how about safety? How about safeguarding the ethical standards and the best benefit of the patient? People will spring that in mind that this patient is now brain dead, but is it any really 0.1% chance that he can be resuscitated? How do we guarantee this sort of protection for patients?
I think that we should be very much sort of guaranteed and safeguarded that, firstly, these patients who are brain dead, they are already having no spontaneous respiration. They cannot breathe by themselves. They are on a ventilator, and then they are having the heartbeat, but then the brain death or the brainstem death is already signifying that the chance of the survival is very low. And then the brainstem death criteria is very much a worldwide standard. And the brainstem death needs to be certified by two separate doctors in two separate times so that to confirm the diagnosis of brain death. So I think that in our society, in the modern clinical era in Hong Kong, we have been practicing this according to the highest standard. So I think the society at large, the general public should be well informed and also be reassured that this is actually practiced to the best benefits and also to the best knowledge of the doctors who are independent of the transplantation. They are not the transplant doctors. The two individual doctors who sort of certify the patients who have brainstem death.
Okay, David, what do you think of our listener Henry's proposal that the arrangement that should be amended so that we should respect the organ donor's wish even after his or her death, and so meaning the family cannot revoke that decision?
I rather think we should stay put on what we are having. That is, we express a wish, and then we respect the family. And, well, of course, I would certainly hope that our family members of the deceased would also respect the wish of their loved one who passed away. Education and persuasion are the ways to go. In our education system, we have always been stressing a lot on career development, but we didn't really talk about what about after your career comes to an end, and then you have to deal with old age, disease, and later on passing away. I mean, it's a relatively incomprehensive way of education if we leave that part out. And one very important message I wish to put to our listeners here is that, well, organ donation is a gift of life to someone who could not survive except with organ donation. Okay, and then organ donation is also, well, you can see it as a continuation of my life beyond death, because my actual tissues or organs are surviving and helping another person to fulfill his or her dream. So that is something very worthwhile.
Okay. But Philip just mentioned earlier the presence of an organ donor coordinator at the hospital at the time of the deceased's death. I mean, so they show up and ask the family to confirm and probably get the final consent from the families at a very grieving time. So I suppose that's a very tricky situation. But at the same time, we can't wait for too long, because I suppose there's a window in which we have to kind of move forward with the organ transplant process. So how much of time are we talking about here?
Now, it depends on the situation and whether the disease can be maintained on a ventilator or medication. You don't want to use too much medication, otherwise that affects the organ quality. And if someone is brain dead, but otherwise still, continuing with the pulse and blood pressure, then maybe several hours or even over half a day's time is possible sometimes to maintain that person on ventilator until the family decides one way or the other. But more importantly, or much more importantly, is that when we sign up, we also tell our family members, especially our parents, that we wish to donate our organ after in case we pass away. So if they know about my wish, then it's much, much easier for, say, my wife to make a decision in front of my parents that she wants to donate my organs away. So to let our loved ones know what we think, our wish is of paramount importance. But going back to the question you asked, we do have some hours sometimes, but in certain situations where the patient, the passed away person is not very stable, then you don't have that much time. And another thing is that what organ you're talking about, because once you take out the organs, then the other timeline would be the time from cutting off the blood supply to an organ until you reconnect the organ to the recipient circulatory system, and it's ischemic time that we have to consider. That's usually several hours. And again, it depends on organs.
Talking about respecting individuals' wishes during lifetime, and some of you mentioned already that the Legislative Council has already passed an advanced decision on life-sustaining treatment ordinance last November, I think, allowing individuals to give advance instructions as to the treatment of their body. Shall we simply include this in the bill as well, in the ordinance? If we are talking about sovereignty of our own body, making decision during lifetime, shall we do that? Would that help the situation? Philip or David, any views?
Yeah, I think that's good thinking, but it's quite a different concept. So the Advanced Medical Directive is for us to decide what sorts of life-sustaining treatment we are not going to receive once I become mentally incapacitated, so I cannot make a decision for myself and fall into a situation where sustaining life is really futile. So it's talking about that particular situation, but not about how my body is to be used afterwards. So I think it's quite a different concept. But of course, we can always discuss whether we can make the wish more obvious, and you can add a line saying that this particular person has that wish and is reconfirmed at this particular moment when they make that advanced medical directive. I think this is possible in the future, But again, it should not be part and parcel of the legally binding advanced medical directive.
I also think that this is probably quite separate and also different, because of advanced medical directive, usually we are talking about is to those who are facing some sort of terminal illness or some diseases that's very likely to affect their life in a very short period of time. So we are trying to help is using the advanced medical directive is about the quality of life of those individuals who are entering their last stage of life. While talking about organ donation, we are aiming at the population at large, which I think that it is a bit different. And sometimes mixing the two together may actually get confusing message to the public. Going back to the point about quickly about the whole body concept. I think nowadays in Hong Kong, I think 99.9% of the people who pass away and they will be cremated. So the whole idea of getting a whole body, it doesn't last for long before going into ashes. So I think that the population should know that instead of going into ashes, that their organs can help a lot more people. I think that they should seriously consider their willingness to help other people and to give out their gift of life. Yeah.
David, did you have something to add?
Yeah. I wish at one point. Now, Professor Lee just mentioned earlier that the team who treat the patient is totally unrelated to the team who ask for an organ donation after the patient passes away. So, again, if we put the concept of agreeing to donate organ crisp and clear on the advanced medical directive, then that message, it shouldn't be there. And it gives people an impression, hey, doctor, would you be considering something differently if someone states in that particular paper that he's going to donate his organ after that? Would that affect the doctor in any way? Of course, it shouldn't happen. But then it seems like you put the sentence there is not the best way, and it's not the right place to put it, because you are kind of telling the treating team that this is a potential organ donor. And I don't think that's a good way to do it.
Okay, we've got about only a minute left, I'm afraid. So, Philip, let me go to you for the final question. So we've had two very successful cases of cross-border organ transplants. So going forward, could this be one of the hopes, for Hong Kong, because we only have 7.5 million people, whereas on the mainland, we have more than 1.4 billion. But then time is of the essence. So, how far can we go in terms of sourcing a donor?
Well, I think I'm totally sort of supportive of the cross-border usage of organs that are not used locally. So I think in case there are organs that is available nearby Hong Kong and then can be transferred to Hong Kong to be used without finding a suitable recipient in mainland, I'm totally supportive of that. And I think that likewise, the reverse should also be true. But having said that, you can realize in Hong Kong, we never have any chance of not using donors that are donated organs available in Hong Kong. So at the time that such a cross-border usage of organs from mainland will be always helpful to the organ failure patients in Hong Kong.
Okay, thank you very much. That was Philip Lee, who's the president of the Hong Kong Academy of Medicine. And joining us this morning was also David Lam, who's a lawmaker with the medical and health services sector.